At Hopkins, we believe for even the most advanced healthcare to succeed, we must first establish a partnership with the patient and the patient's family. Trust and communication are essential to positive health outcomes. We have the spectrum of specialists, even from the fetal life on to pediatric subspecialists and then to adult specialties, all within the same roof. That can tap into a lot of expertise for very difficult and complex diseases.
A lot of patients with congenital heart disease who come to see a general cardiologist eventually may develop arrhythmias. And so what you want is a team that's able to take care of every aspect of your cardiac needs. We treat all varieties of heart rhythm disorders, everything from the most benign palpitations and straightforward arrhythmias like SVT, which are pretty common in normal healthy children, to the most complex and life-threatening hereditary arrhythmias. We also like to take a step back and treat the entire patient. You're not just treating the electrical system, you're treating the entire patient, the entire family really.
We need to get the diagnosis right. Not 9 out of 10 times, we need to get the diagnosis right 100 times out of 100. We have a range of modalities, whether it's ultrasound or MR or CT, and we have the best equipment that there is.
Look at the pictures of the heart here with the colors.
People may not understand is not only the pictures, but there's tremendous information, quantitative information behind those pixels. It's not just seeing a pretty picture of the heart, it's understanding all that depth of information that's behind that picture and then using it to help figure out what's the best thing to do for the child.
We're seeing more and more premature infants born, and we have a very high level NICU, obviously. Standard of practice for our neonatologists here is to screen for pulmonary hypertension as babies get closer to discharge. So nobody's missed. And then once we have the diagnosis, we know what to do with it. We're looking at new techniques, ways we can look at the function of the right heart. Together with the echocardiography, we can use a lab test that will help increase our diagnostic and prognostic accuracy.
We treat many very complex congenital heart defects that require open heart surgery in small infants and children. The surgery is generally quite successful, but requires additional procedures as the child grows. And we can offer that additional intervention by catheterization now rather than requiring another open heart surgery.
We have a center of excellence for the care of children with a type of condition called a connective tissue disorder. The pediatric cardiology infrastructure provided a means for us to provide excellent care for these patients. As a result, those patients came from all over the country and all over the world for their care at Johns Hopkins. That really provided a research opportunity for us in genetics. We were seeing a large population. We could start asking questions like, what gene is causing your disorder?
The left ventricle, right atrium, right.
I think what's unique about an academic medical center is that people are curious about the forces driving the disease. We're more likely to try to individualize our care, to try to consider what will work best for this person sitting in front of us today.